Hi, everybody. Welcome back to The Breathing Specialist. This is Kelly Welton. Today, I wanted to give you guys a little bonus webinar because this is probably the biggest, most often asked question that I get is inhalers and spacers, and especially using them correctly on kids because kids kind of can be a little bit difficult. You can use these on young children. You can use them on babies. It really depends on your child, but there is a way to do it. So you're at work and you get that dreaded phone call. The school nurse is calling to tell you your child's having trouble breathing. Should she give them the inhaler? What should she do? Or maybe your child tells you it's hard to breathe again, or maybe they're sleeping, but you can hear them wheezing during the night. And you know that feeling. Should you take your child to the doctor? Should you go to the emergency room? Should you go to the clinic? Should you call 911? Should you just let the school nurse handle it? What is the deal? So first, I want to say, does this happen frequently? If your child has to go to urgent care, the emergency room, or your doctor's office emergently for breathing troubles more than 2 times a year, then you may not be getting enough medication from your inhaler. It could be other things. It could be you need different medications, but most likely the culprit is you're using rescue medications and you may be using a spacer, but you're not getting enough medication into your child's lungs. And that is the point of an inhaler and spacer, is get that medication down deep in the lungs and let it sit on top of the lung tissue where it will do the most good. So if your child has to use your inhaler more than 4 times a day, then you may not be getting all of the medication every time you use it. You may need a better controller, or you may need more controller medication, or you may need more or different medication for allergies. If your child has not been tested for allergies, I strongly recommend that you get that done. It could even be something really simple, something such as a food additive or an artificial coloring might be keeping your child tethered to their inhaler. So I really strongly recommend clearing out artificial colors and artificial flavorings and artificial sweeteners, pretty much artificial everything out of your child's diet. Read labels carefully because they sneak things in there. So the first thing, using an inhaler is kind of tricky, especially on a young child. So make sure that you have a spacer. If you don't have a spacer, then you can use a homemade spacer. I know this is kind of a funny looking one here in the picture, but this is better than nothing. You want to have a professional spacer only because the inside coating of that spacer is made so that the medication doesn't stick to it. So when you use something like this, a water bottle, it's better than nothing, but still a good portion of the medication sticks to the plastic and you don't want that. But I would rather have some medication stick to the plastic and have the rest of it get into your child and have to do a couple more extra puffs than not using it at all. So here's the trick. Inhalers work again by getting the medicine deep into the lungs, and what spacers do is they hold the medicine in suspension so they can allow the medication particles to travel deep into the chest when your child inhales slowly. So timing is the key. So step one, you want to look at your child's breathing pattern. Make sure that they are not breathing too fast so that they won't get any medication in. But just notice your child's breathing pattern. You want to place the inhaler mouthpiece into the spacer, gently shake while you're observing your child's breathing. So move the spacer mouthpiece or mask close to your child's mouth off to the side. Ask your child to breathe in deeply and then all the way out. And at the end of your child's exhalation, depress the inhaler, you'll hear it spray, then place the mouthpiece in the child's mouth or the mask over their face and have them breathe in slowly. Now remove the mouthpiece or the mask and ask them to hold their breath if they can for a count of 5. Really young children may not be able to do this. That's okay. They can do the best they can. And have them exhale out to the room and not back into the spacer. If your prescription says another puff, go ahead and repeat. Now for very young children, they may need 5 or 6 breaths with the mask. to inhale all the medication. So if you're giving your child medication with an inhaler and spacer with a mask on it, then you want to go ahead and leave the mask on their face and get them to inhale 5 or 6 breaths so that they do get all the medication in. Now don't forget, if your child is taking a corticosteroid, be sure and have them rinse their mouth and gargle and spit out the water if they're able to do that. If they're not, it's okay. Have them just drink a little bit of water. So just in case, I've embedded a video here. You should be able to scroll over it and you will see the video play. That's me. That's a live demonstration without a mask, but on the timing of using an inhaler and spacer. So again, you want to get the full dose and you want to get it to the right place. So correct technique with an inhaler and spacer will make sure the medicine goes where it's supposed to. If you don't use a spacer or you breathe in too fast or you don't time it correctly, you may deposit the medication in the mouth and throat. They don't do any good. Now don't put the spacer jacket, or I'm sorry, the inhaler jacket directly into your mouth. Again, this leaves the medication stuck in the back of the throat. And poor technique leaves your child under control. They're not getting all of the medication that they need, so then they need additional medication all day and sometimes all night. So a lot of kids, I see this, they don't want to carry that big fat spacer at school, so they just carry their inhaler in their backpack. Or they leave the spacer with the school nurse, and then when they need a puff, it's too much trouble to get all the way to the school nurse, so they just use your inhaler like this, straight from the jacket. And again, that's not going to get the medication where it needs to go. You need to use some form of a spacer. And another question is, could it be something else, the reason why your child is needing so many puffs off of the inhaler? So allergies, pollution, chemicals, all these things can trigger asthma attacks. And I'll talk a lot more about these at another time. So what if my child can't breathe now? Then should I go ahead and try this with a spacer? So let me just give you the disclaimer. If your child's having trouble breathing, if they can't talk in a full sentence, their lips or fingers are blue, get your child to an urgent care facility or an emergency room right away. If your child seems lethargic, they're continually coughing, you can see your child's ribs with every inhale. This is especially important with babies and very young children. If you can see their ribs with every inhalation, get your child to an urgent care or an emergency room right away. So using your inhaler and your spacer correctly can help you avoid these kinds of emergency trips. If you'd like to learn more, you can join me on my upcoming webinar. You can visit www.copdsuccess.com/asthma. And in that webinar, I talk about the 10 most common triggers that trigger an asthma attack in your child and how you can avoid those. So I wish you a happy and healthy life, and we'll see you soon. Thanks for joining.